Welcome back to the deep dive. We are really glad you're here with us today.
Yeah, absolutely. We've got a lot of really fascinating stuff to cover today.
We do. And today's mission is all about exploring this big stack of medical guidelines, physical therapy manuals, and holistic health booklets.
Right, a whole mountain of source material.
Exactly. And we're looking for the best strategies to transition away from like constantly running to the doctor or the ER for a magic cure.
Huh.
We're talking about shifting to empowered at-home self-management for chronic pain.
Which is such an important shift, because modern medicine really conditions us to think, well, if it hurts, a doctor can just fix it.
Right, you go in, they patch you up, and you're at zero pain. But the most surprising takeaway we found right off the bat is that getting your pain to zero isn't actually the goal.
Yeah, that really is a jarring realization for a lot of people.
It is. Because the ultimate goal isn't necessarily zero pain. It's getting your life back to 100%.
Exactly. The acute injury model where you fix the broken thing and the pain stops, it just fails completely when we're talking about chronic pain.
And to really understand why that is, I like to think about it like a car alarm.
Oh, yeah, the car alarm analogy is perfect for this.
Right. So acute pain is the alarm going off because someone is actively smashing the window, like someone is actually breaking in.
Yeah, there's acute tissue damage, a broken bone, a burn. You need that alarm to react.
Exactly. It's loud, it's annoying,
Yeah.
but it's keeping you safe. But chronic pain is, well, it's the alarm blaring constantly at 3 in the morning.
When the car is locked in a perfectly safe garage.
Exactly. The threat is totally gone. The window was fixed months ago. But the system's wiring has just gotten overly sensitive. A slight breeze hits the garage and the alarm just screams.
And that's actually grounded in the clinical research we're looking at today. The medical community defines chronic pain as pain lasting longer than 3 months. But the revolutionary part is that it's no longer seen as just a lingering symptom. It's actually recognized as a distinct disease state all on its own.
Wait, so the persistent alarm is the actual disease itself?
Yeah, exactly. When pain persists for months, it actually causes neuroplastic changes. The nervous system physically rewires itself.
Wow.
Clinicians call it nociplastic pain. The pathways in the brain and spinal cord become overly efficient. The nerve receptors multiply and they just start firing pain signals even when there's absolutely zero new tissue damage.
So the car's body is fine, but the internal computer is just completely fried and stuck in the on position.
Exactly, which means you can't just treat the bumper, right? You have to treat the computer.
And that brings us right into the psychological barriers, I think. Because before you can even try using physical tools at home, you have to deal with the brain's reaction to this alarm.
You really do. You can't fix the body if the brain is just stuck in this endless loop of fear.
So let's talk about that loop. The sources call it the chronic pain cycle, right?
Right. It starts with the pain, which very quickly leads to this deep fear that any movement is going to cause physical damage.
Right. Like if bending over hurts, your brain just screams, don't bend over, you're breaking your spine.
Exactly. So then you start decreasing your activities. You withdraw. And that avoidance leads straight to physical deconditioning, muscle atrophy, and usually weight gain.
Which just makes everything harder physically.
Right. And then you get all these negative emotions, frustration, depression, which causes more distress, more withdrawal, and ultimately more pain.
So I have to ask the question that I know you are probably shouting at your phone right now if you're listening to this, and your back is just throbbing.
The most logical question in the world.
Right. Like, wait, if moving hurts, doesn't that mean I am actively damaging my body? Like, how do I just ignore my own survival instinct?
It's terrifying. The guidelines completely acknowledge that, but this is the most crucial concept here. Patients have to learn that hurt does not necessarily equal harm.
Hurt does not equal harm. That is,
Yeah.
I mean, we really need to underline that.
Because of that faulty car alarm wiring, your nervous system is flooding you with intense pain signals even when the physical structures are totally safe to move.
So the pain is completely real.
100% real. It's not in your head, but you aren't actually harming the tissues.
And if we let that fear stop us from moving, we fall into what they call fear avoidance.
Yes. And that's where the real physical deterioration happens. You stop gardening, you stop walking, and your muscles just atrophy. Your joints get stiff.
I was reading the section on cognitive behavioral therapy, or CBT, in the sources, and it outlines how this deconditioning triggers this massive emotional cascade.
Oh, the psychological distress is huge.
Yeah, I mean, dealing with constant pain while your world just shrinks, it causes so much anxiety and depression. And what's wild is that these emotions act as a biological amplifier for the pain.
They absolutely do. When you're anxious, your brain releases stress hormones like cortisol. You get stuck in fight or flight mode.
And that causes actual physical inflammation, right?
Yes, around the nerve endings. It makes them even more sensitive. So the psychological distress literally creates more physical pain.
So things like CBT aren't just about, thinking positive thoughts. It's an active intervention to stop those stress hormones from dumping into an already inflamed nervous system.
Precisely. It's about reframing your entire role as a patient.
Because if you just think, it's my doctor's job to cure me, you're just passively waiting for a silver bullet that probably isn't coming.
Right. You have to shift to noticing the small, temporary ways you can manage things daily, improving your function and quality of life.
Okay, but practically speaking, how do we actually do that? I mean, it's easy to say hurt doesn't equal harm, but getting off the couch without triggering a massive flare-up is a whole different story.
Well, if you try to just jump back into your old routine through sheer willpower, you will inevitably trigger a severe flare-up.
Which just reinforces the fear, right?
Exactly. So the answer is meticulously managing your functional baseline.
And the rule for this in the clinician handbooks is honestly pretty striking. Whatever expectations you have for your physical activity today, you need to cut them by at least 50%.
By half. Yes.
And start your baseline there, which, sounds kind of aggressive.
It feels incredibly restrictive to someone who just wants to get their chores done, I know, but it's a biological necessity.
It's like, well, I think about it like an older smartphone with a totally shot battery.
Oh, that's a good way to look at it.
Right? If you wake up and open 15 apps, turn on the GPS, and stream a movie, the phone is just going to overheat and die in 20 minutes.
It just doesn't have the capacity anymore.
Exactly. You have to close background apps, turn down the brightness, use low power mode just to make it to the end of the day.
And that captures the concept of pacing perfectly.
Pacing. So what does that actually look like in practice?
It's alternating rest periods with activity. The goal is to prevent muscle atrophy by moving, but stopping well before you overheat the nervous system.
Well, before the alarm goes off.
Right. The sources suggest taking scheduled lie-down relaxation breaks throughout the day.
There was this great anecdote in the CBT guidebook about a guy named Chris that really stuck with me.
Oh, right. The gardener.
Yeah, Chris loves gardening, but has chronic knee pain. And his old method was just a boom and bust cycle. He tried to trim every bush, push through the agony, and then spend 3 days bedridden.
Which is the worst thing you can do, because that boom and bust cycle proves to the brain that the environment is actually dangerous.
Right. So he started pacing. He'd bring a lawn chair outside, sit down to trim the lower half of the bushes, and then before the pain spiked, he'd take a scheduled break.
And the guidelines specifically say to actually lie down, taking all the mechanical load off the joints.
Exactly. Then he'd go back out, stand up, and finish the top half of the bushes.
It's brilliant because he's not just resting his knee, he's actually managing his central nervous system's bandwidth.
He avoids that massive cortisol spike. He gets the yard work done, feels accomplished, and keeps his mobility. That's getting your life back to 100%.
Even if the knee is still at a pain level of 5.
Right. But there's another reason he has to be so careful. And this was honestly the most surprising fact in all the research for me.
The balance statistics.
Yes. The data shows that otherwise healthy people in their 40s who have chronic pain have balance scores similar to people in their 80s.
It's staggering, but it makes sense when you think about the cognitive load of chronic pain.
Like your brain only has so much RAM.
Exactly. And a massive chunk of that processing power is being used to deal with that blaring car alarm. So there's less bandwidth for proprioception.
Which is your body's awareness of where it is in space.
Right. So a 40-year-old is at a higher fall risk just because their brain is too distracted by pain to monitor their footing.
Wow. So I'm guessing that means you really need to avoid complex exercises.
Definitely. You shouldn't be trying to memorize a 30-step aerobics routine. Avoid fast pivots. Keep it simple and predictable.
Which totally redefines how we should set goals. If your goal is lower my pain from an 8 to a 4, you're setting yourself up to fail.
Because you can't consciously control the nerve endings.
Right. But if the goal is, I want to sit on the floor and play with my kids for 20 minutes, you can control that through pacing and managing the baseline.
Focus on the function, and the pain score often slowly adjusts over time as that fear avoidance goes down.
Okay, but let's be real for a second. Even with perfect pacing, flare-ups are going to happen. It's just inevitable.
They absolutely will. It's the nature of the condition.
So when the alarm spikes, what specific tools can we use at home instead of just, rushing to the clinic in a panic?
This is where building an at-home physical toolkit is so empowering.
Okay, let's start with thermal therapy. Almost everyone has a heating pad or a bag of frozen peas, but we usually just guess which one to use.
And the manuals are surprisingly strict about this. Ice and heat cause opposite physiological responses. They aren't interchangeable.
Right. The breakdown is basically this. Cold packs cause vasoconstriction. They shrink blood vessels. So cold is strictly for hot, swollen joints or brand new injuries.
Where you need to restrict blood flow to stop immediate inflammation.
Right. But warm packs cause vasodilation. They open the vessels up. So heat is for stiff, aching joints and tight muscles.
The heat brings in oxygen and relaxes the tissue.
But wait, I have to ask, is a hot water bottle just like a nice distraction for your brain? Or is it actually doing something to the pain signals?
It's actually altering the signals through something called the gate control theory of pain.
Gate control theory. Okay, what does that mean?
Well, the clinical term is competing sensory central nervous system input.
Is that like when you stub your toe and your immediate instinct is to just aggressively rub your foot?
That is exactly what that is. The nerve fibers that transmit touch and temperature are thicker and faster than the fibers that transmit throbbing pain.
Oh, wow.
So when you rub your toe or put a hot pack on your back, those fast touch signals race up the spinal cord and basically cause a traffic jam.
So they literally beat the pain signals to the gate and block them.
Yes, they close the physiological gate. You manually flood the system with non-pain data, which forces the brain to turn down the pain volume.
That is fascinating. And that traffic jam concept perfectly explains the next tool in the kit, the 10NS unit.
The transcutaneous electrical nerve stimulation unit. It's a phenomenal application of that exact theory.
And these used to be huge machines at the physical therapist's office. Now they're, what, the size of a deck of cards?
Yeah, they run on batteries and clip to your belt. You stick small electrode pads around the painful area, and it delivers a mild electrical current.
But it's not like getting shocked, right? It doesn't make your muscles spasm.
No, not at all. It just feels like a gentle buzzing or tingling. And that continuous buzzing provides relentless, competing sensory input to keep the spinal gate closed.
Blocking the pain signals without any heavy pharmaceuticals. That's incredible. Now, the toolkit also mentions something called biofeedback, which sounds a little sci-fi to me.
Well, if CBT manages the psychological stress, biofeedback helps you manually override the physiological stress response.
It sounds like reverse engineering your anxiety. You use a small device or a phone app to monitor things you normally wouldn't even think about.
Right, metrics like your heart rate variability or how shallow your breathing is.
Because when you're in a flare-up, your body is locked in fight or flight. Your breathing is shallow. Your heart rate is rigid.
And the biofeedback app gives you a visual, like a jagged red line showing exactly how stressed your system is.
Then you use deep paced breathing to literally force that graph to smooth out and turn green. You watch yourself shift back into a rest and digest state in real time.
You're objectively proving to your brain that you can control your internal environment. It cuts off the cortisol supply and really reduces the duration of a flare-up.
Okay, so the final piece of the at-home puzzle is daily ergonomics. And this isn't just about sitting up straight at your desk, is it?
Not at all. It's about auditing your daily activities. Cooking, cleaning, working, using good posture and body mechanics everywhere.
Problem-solving your environment, like Chris with his lawn chair.
Yes. Ergonomics is basically the minute-by-minute application of pacing.
So, to synthesize everything we've talked about today, transitioning away from relying on doctors to self-management doesn't mean the medical system has just given up on you.
Definitely not. It means you're graduating to a level of care where you actually hold the reins.
Right. By shifting your mindset, knowing that hurt doesn't equal harm, you break the fear cycle. You protect your baseline through pacing, and you use your toolkit of thermal therapy, TNS units, biofeedback, and ergonomics to control the flare-ups.
And the psychological impact of that is huge. Chronic pain can feel so isolating and overwhelming.
Yeah, it really strips away your agency.
Exactly. But learning these tools replaces that helplessness with empowerment. It restores your dignity. You aren't just a passive victim waiting for a cure anymore.
You are an active manager of your own nervous system.
Well said.
And I want to leave you with one final kind of provocative thought to mull over.
Okay, let's hear it.
We've learned today that chronic pain can literally rewire the brain to become more sensitive. That faulty car alarm.
Right, neuroplasticity.
But neuroplasticity works in both directions, right? The brain is completely malleable.
It is.
So could the daily proactive practice of self-management pacing, using competing sensory input, lowering cortisol, and finding joy despite the pain, could all of that eventually rewire your nervous system to permanently turn down the volume of the pain itself.
Oh, wow.
Like if the brain can learn to leave the alarm on, it stands to reason that we can teach it to finally quiet down.
The literature strongly suggests that's a very real possibility, and it begins the moment you decide to take that first, carefully paced step.
That's a really hopeful place to end. Thanks for joining us on this deep dive. Until next time.